Welcome to my podcast. So today I'm going to talk about another case. It's about knee pain. So basically, after you introduce yourself and double check the patient name and date of birth, you'll ask the patient, "How can I help you today?" So the patient will say that, "Doctor, I'm having pain in my knee. I can't move. It aches me. I'm not able to walk. I can't do my normal daily activity. It's stopping me from doing things." So we'll ask the patient, "Could you tell me more about it?" And when the patient finish their story, you will ask certain questions just to narrow down, basically to certain differential you could come up with. So basically, you will ask, "Do you have any history of trauma at all? When did this pain started? Was it acute or gradual? Any associated symptom? Anything could increase or ease the pain? And do you have any thoughts or idea what might be the reason for your pain?" And after exploring all of that, you will ask if the patient had done anything to ease the pain, if they took any OTC medicine. And also you will need to ask about any past medical history, like for instance, diabetes, any long-term illness. And then you'll ask about the allergy, if there is any known allergy, and family history, if the patient, there is any family history that runs in the family. And then you will ask about the lifestyle, which basically about any activity they do, like, certain exercise or running, jogging, hiking. And then you will ask about the smoking habit, drinking habit, and of course the diet habit. And then you will try to narrow down the history. So you will ask, have you noticed any swelling at all? Have you noticed any redness? Is there any cut? Is there any popping or snaps sound in the knee, for instance, when you stretch it or when you flex it? Do you have any pain at all? Does it awake you from sleep? Does it affect your sleep, your mood, your activity? In certain situations, like young teenagers, especially young females, they tend to do a lot of exercise. So this could be fitting with Osgood disease. If the patient is unable to straighten, for instance, the knee, and they have issue with locking their knees, or unstable. So you could think of ligament or matter of meniscus. And also you will think about if the patient, say for instance, an old age, or even certain young age, if it's painful and has stiffness, swelling, you could think of wear and tear, osteoarthritis. If there is any swelling or reddening, also you might think of certain situation like bursitis. And certain situation, it could be bleeding in the joint, if the patient taking any blood thinner, for instance, or anticoagulant. And if it's acute, red, painful, you could think, of course, of gout or septic arthritis. For instance, I remember myself when I've been assaulted a year ago by this e-bike who was running at high speed, and I was walking forward in the pavement, and he hit me from my back at high speeds, which made me fall forward in my face and my hand and knees. I just got, instant nose bleeding, 2 bumps in my face and my cheek, and 2 black eyes, fractured my left hand, and caused me issue also with my knee and my neck. So at certain time, when I was complaining of my knee, no one took me seriously. And until a stage whereby I couldn't even pray, I couldn't even bend my knee. I was in too much pain, couldn't sleep at night, and I was really worried what's going on. So they decided to send me for urgent MRI, which shows extensive bone marrow edema, which is very painful. Till now, I'm having that pain. They say it's going to take 2 years to subside, and there is microfracture as well. So can you imagine all of that just happened from someone who's inconsiderate, caused me a lot of struggle and a lot of pain. I just wish him hell and wish God send him what he deserves. So let's move on. Also, you need to think about the kneecap as well. It could be dislocated, could be fractured, it could cause pain, it could cause, when you press on it, you will feel if it's, when the fluid around it would pop in or not. So all of that could be falling under the differential of knee pain, whether it's acute or a gradual. So basically, you will tell the patient you need to ease your knee pain by avoiding too much weight or prolonged standing, and try to elevate your knee. So basically, you can sit on a sofa or a chair and put something in front of you and raise your leg. You could put also frozen bees wrapped in a towel, and you can apply for 20 minutes just to ease the pain, ease the swelling, and can be repeated 3 hourly. And you could also prescribe a simple painkiller and see how it goes, like for instance paracetamol, ibuprofen. However, don't forget to safety net the patient. Of course, after you examine the patient, when they say, okay, I'm happy for you to examine me. And of course, don't forget about the chaperone, because if it's a male doctor and examining a female, so she might be shy, she might not want it to be examined by a male doctor. Muslim community, we might not feel comfortable to allow a male doctor to examine our knees. So always you need to ask for same gender if there is a possibility, and of course a chaperone, just to be on safe side. So after examining, of course, the knee, you need to examine for any obvious physical issue like deformity, injury, cut, bruise, swelling, redness, and then you need to feel for the tenderness, for the warmth of the skin, and don't forget about, of course, checking for the pulsation in the popliteal fossa. And you will, of course, as I mentioned, warn the patient if there is any locks or clicks, that he needs to come back to the doctor, to the surgery. And if the condition did not improve at all, or if the knee become very painful, can't move the knee, can't bear weight on it, or increase in the temperature, you need to come back immediately, or dial 111 or go to the A&E immediately. So, but it's basically in relation to knee pain. And always when you need to say about the management, never to forget about the agreed doctor-patient management plan. Thank you.